Welcome to the Star Podcast.
Whoa. Star Podcast.
Welcome to the Star Podcast, hosted by Nat. Each week, we share tips and stories from safety, trucking, and recruitment, and everything in between. Listen now.
Welcome back to another episode. Today I'm actually bringing back a previous episode that we recorded with Lisa at New Day Wellness. Now, this episode goes into mental health resources, and because this week is Mental Illness Awareness Week, and tomorrow, because I'm recording this on October 9th, October 10th is Mental Health Day. So I thought, what better than to bring back an expert that not only works with wellness, but she works with mental health. She's a mental health first aid trainer, and she has some really great resources. So I just thought this is such a fantastic episode. I tried to edit out some of the things that weren't relevant, like a webinar she was doing back when we recorded previously, but she has a YouTube channel, she has a podcast. She herself has so many great resources that I thought I'd link to those in the show notes, and it's a really great episode to listen to, so listen now.
So I just want to thank you so much today, Lisa, for joining me and sharing your knowledge. I'm excited to talk and learn from you, so welcome.
Well, thank you. It's great to be here, Leslie.
I thought maybe you could start by sharing a little bit about yourself and how you got to where you are today.
I started a company called New Day Wellness over 10 years ago. We're running close to 12 years now, actually.
Wow.
And it came out of a desire to support the wellness needs of workers in Northern Ontario, because in my role previous to that, I noticed a lot of individuals were struggling to pass pre-employment medicals, breath alcohol, and drug tests. And it really concerned me that a lot of people's livelihoods were counting on their health and well-being. And when it came time to branch out and really do what I'm really passionate about, I felt like we really needed to bring health to health and safety. And that's how New Day Wellness was born and has grown since then. And now I've gone international. Like the virtual world has allowed me to expand the business and share the reach much farther than it was 10 years ago. And that's where we are today.
Amazing. And you have your own podcast called Your Wellness. And
yeah, there's a lot of cool platforms that we can share our message as well. So yes, the podcast is in its 5th season, and any opportunity to talk about health and wellness, especially for the health and safety industry, I'm all over it. And I'm so glad that you invited me to talk today.
Well, for sure. Well, we were talking before I hit record, just saying that we do a lot of tips about, workplace safety, chainsaw safety, confined space safety. But one kind of missing piece, I think, was we weren't doing a lot about mental health, which I think is so important, but maybe not talked about as much. So I thought, if you can come on, because you're the expert, and share a little bit.
Sure. There's a lot of awkwardness when it comes to talking about mental health. There's a lot of unknowns. A lot of people aren't educated. And we really need to make this a normal conversation and not scary and not uncomfortable, because it still is.
For sure. And I think you can't see it. It's unknown, I guess, to a lot of us, and we don't know how to speak about it.
Yeah, and it's also scary, Leslie. It's scary to those who are not comfortable with it, or having a discussion about it, or being vulnerable and sharing their own wellness journey and having a decline in mental health. So making it normal. And in the industry of health and safety, it is a neglected conversation that we really have to include in part of chainsaw safety and falling at height safety, because who wants to work in an unsafe environment? If you're working alongside a colleague who is not focused on the job, that's a dangerous day. Absolutely. That could be a critical day. So we really need to include this in part of our training programs.
For sure. I saw actually one of your podcast episodes was talking about someone who there was a link between their mental health and then they had a workplace accident, and that went hand in hand as to why that accident happened. So it was preventable. That was an interesting point, I thought, to be brought up, that people should be aware of more. For sure, it's important.
I just wanted to add to that podcast, because what's the definition of fit for duty? Like when you're looking at your colleagues, or as a supervisor, checking out the health of your staff, or are they fit for duty? It's hard to identify if someone is having a distracted day or suffering from a mental illness or, has a substance use disorder that they've been able to cover up. What does fit for duty really look like? And sometimes it's after someone falls off a ladder and becomes paralyzed, like this poor individual did. And then he's realizing, you know what, I really wasn't fit for duty. And whose responsibility is that? And who holds the onus on that? And it comes to the actual worker and the employer. It's kind of like a partnership when it comes to that.
Yeah, absolutely. So what could someone do if they're worried about their mental health or maybe the mental health of a loved one?
Well, it's important to identify it, notice it, and not be afraid to have a decline in your mental health or not be afraid to ask somebody about their mental health. When it comes across as a compassionate, empathetic conversation, then it can really reveal some things that require some attention. So I think if we are judging people and assuming this is something that has a stigma, we're going to be less comfortable talking about it. So bringing in the empathy piece and really acknowledging that I'm bringing this up because I care about you, or mentioning it to someone because I'm worried about my health, myself. It's going to take us into the process of, okay, now we identified, let's do something about it so we don't suffer any longer. Recovery can start sooner. I'll be safer, I'll be happier. But until we get to that fork in the road of actually acknowledging it, people are going to continue to hide it and suffer. And it's really not, it's not valuable when you look forward into it. You want to have a happy life. So we're pausing that and staying stuck. And it's not necessary. It doesn't have to be that way.
So do you have any tips for how to communicate effectively about mental health, whether it's in the workplace or at home?
I have lots of tips, and I find that learning how to communicate doesn't happen naturally. It doesn't always happen at home. We don't talk about it at school. And communicating about mental health is another level of communicating. And one of the tips that I really like to emphasize is there's a really powerful quote from Stephen Covey, who wrote the book, 7 Habits of Highly Effective People.
Mm-hmm.
And he has a great quote that I share with as many people as possible. And he says that most people don't listen with the intent to understand. They listen with the intent to reply. So that explains that we're not really listening. We're just trying to prepare to respond and have an answer or have a solution to whatever the person's saying. And so I want to give people I want to release the burden to make people realize it's not your job to fix the problem. You don't have to have a great reply. You don't have to know what to do. You don't have to know anything about mental health. You just need to be a good listener and empathetic and non-judgmental. And that's all someone usually needs, is just to be heard and validated. So coming up with some solutions is it's not effective, and you could be wrong. So take the burden off. It's not your job to fix it. They probably don't want you to fix it. Just be a good listener.
That is probably the best piece of advice I've ever heard. I've heard that quote before and I thought it was so good, but just to listen, because I know sometimes if someone's going through something, I'm like, oh, I don't know what to say, but that's so good. You don't have to know what to say. You just have to be able to, be supportive, not maybe say anything, just say, I'm here for you, and let them talk.
Well, good. I'm glad it helps, because I think we put so much pressure on ourselves to be that person that knows everything about everything. And that's just not possible. We're not all psychologists. So leave that to the psychologists and just be there to listen and empathize. And that takes practice, though. You have to give yourself permission to not have to fix it. And you get better by doing that. Do it a little bit more. Start with your kids. Maybe just let your kids vent without trying to fix the problem. It's also a good relationship tool, because communication is the reason most relationships break down, is lack of communication. Mm-hmm. And again, we don't always learn how to communicate with our spouse or with our friends or with our colleagues. And we really need to understand that most of us generally just want to be heard. Just listen without judgment. And they're going to keep coming back to you. They're going to keep coming back feeling safe, feeling like this person is going to understand me and not try to fix me or change me. And that's the same for kids, especially teenagers. They will stop coming to you. They will stop talking to you if they think you're just going to tell me what I should have done.
Where could someone go to find resources about mental health, whether it be for themselves or for someone else?
If you've ever Googled anything about health, it's kind of scary, because you could find yourself going down the rabbit hole to nowhere land. You don't know where you're going to end up. You've suddenly diagnosed yourself with a horrible disease, and that's really a scary place to end up. I would recommend 211north.ca for anyone who has someone that they know that they feel require a professional support or some resources, or for yourself. This is a really good active current resource that is for Northern Ontario people. So 211north.ca will get you to a resource center that's active. And what you do is you indicate where your community is. So if you're in Kapuskasing or Timmins or New Liskeard, you will find close resources. So you don't have to travel to Toronto or a place that's going to cost you a lot of time and money. So there's also 211.ca, which is another provincial initiative. That's great to have access to current resources. Paying for psychologists and psychiatrists has been a common problem I'm hearing. It's a barrier for some. So there's a website called Mind Beacon that offers free resources, and it's a start. And so there's 211north.ca, there's Mind Beacon, I think it's .ca, and there's one for parents, which I think is a really unique organization, and it helps parents gain the skills if they have a child who's experiencing a crisis. And that's called the Sash Bear Foundation. And the Sash Bear Foundation really helps, like I mentioned, parents who just don't know how to support their child, because we're finding children at younger age experiencing depression and suicidal thoughts. And, most parents don't know what to do with that or how to identify it. So Sash Bear Foundation is a really good organization that helps that. I work with parents who have lost their children to suicide. It's not my sole practice, but it just happens in the wellness realm where some families are struggling with a lot of things. And this has come up more than once from some of my clients. And the first thing they say to me is they wish they had known more or done something different. And the guilt that they live with is just relentless and heartbreaking. So if we can get the skills to prevent our children from having these suicidal thoughts, because we understand them, we're hearing them, and we know how to use the right words, we could prevent someone from dying, which is ultimately my passion. And we have to give ourselves permission to learn more. We need these tools.
Absolutely. Well, this was an amazing conversation. I appreciate your time so much, and the resources you shared. I just appreciate you so much and the work that you're doing. And thank you so much for joining us today.
Oh, you're welcome. Thank you, Leslie.
No, thank you so much.
Whoa. Star Podcast.